Welcome Gold delegates from around the world. I'm Fleur Bickford, Program Director and MC for Gold Conferences International. And I'm here today talking with Asti Praborini, who is one of our speakers for our upcoming Gold Lactation Conference. So Asti, welcome and thank you so much for joining us today to talk about your presentation titled Hospitalization for Nipple Confusion, a Method to Restore Healthy Breastfeeding. Thank you for being with us.
Okay, how are you? How are you, everybody? Hello, I'm from Indonesia.
Welcome. So, Asti, perhaps you could tell us a little bit about yourself, about your professional journey and what it is that you do and why you chose to become an IBCLC.
Okay, I was once a GP working in Papua, the very west of Indonesia. I work with a lot of poor people there, and I see that breastfeeding could help them to decrease infant mortality rate. And then I become a pediatrician. And when I was studying, I know that breastfeeding is a very good for uh, decreasing infant mortality rate, and that's why I then become an IBCLC, and in it was 8 years ago, and then I built also lactation clinic in 3 hospitals, and also work in pro bono for poor people, where some they get easy sick with pneumonia, diarrhea, and also cancer because they don't boil the water, and they can't afford to buy formula milk. That's why maybe the infant could get sick and die. So breastfeeding is the only one to help poor people and all the children in the world, in our country especially, because we are in developed country. So breastfeeding will help to increase the health of the children here.
Okay, thank you for
Because for
that.
poor people, vaccination is also maybe cannot afford that sometimes.
Okay, yeah, definitely, you know, a great thing in those kind of circumstances to have somebody like yourself who can help those moms with breastfeeding is so important. So I wanted to ask you about your topic that you're going to be speaking on. I was really interested in your topic because in, you know, where I come from in Canada, it's not something we would think to do to hospitalize a baby for nipple confusion. So I was wondering if you could tell us a little
Yeah,
bit about
yeah,
your method and why you decided to try hospitalizing the babies who are struggling with nipple confusion.
yes. Yeah, when we open the clinic, then so many people come, so many mother come with baby who cannot latch at the age of 5 days, at the age of 1 month, sometimes at the age of 3 months, 9 months. They come and say to me, "Please, doctor, help me. I want to breastfeed my baby." And when we just make skin to skin contact, and you just try to give a to uh, to give a glass in the house and just make skin to skin contact, it doesn't work because the baby cry a lot, and then the grandma and the grandpa, you see in Indonesia, people live in extended family, so the grandma and the grandpa will say, "Oh, my grandchild is crying a lot. Why don't you give just bottle?" And they give bottle and bottle again, and the mother cannot latch the baby on the breast. So we have to hospitalize them, maybe for 1 day, maybe for 4 days, to just make the mother calm and the baby also calm, and the baby will always be there. There will be somebody to latch on the baby with the mom. And when the baby cry, my nurses and my team will give the baby from the glass or for with tube, anything, just to let the baby win from the battle, and also make skin to skin contact. And it works. We have from 10 mothers, 9 could go home with breastfeeding only. and that's good. And from our research, the duration of the breastfeeding will stay long, because here in our country, people breastfeed their babies for 1 until 2 years.
Okay, thank you for that. It's
That's
so
what, yeah,
interesting.
yeah,
It's so interesting to hear about that approach, and I think it's you know, it's a really interesting point about the extended family and the impact that they can have. And I mean, even in Canada, we see that sometimes where, you know, and even if it's not extended family, just outside influences are providing a lot of pressure. So really
yeah,
interesting. It's great that, you know, your team is able to provide that sort of support for the moms in an environment where she is supported and has that help.
yeah,
It's really, really
yeah.
interesting. So I really like
I
that.
have, yes, I have three pediatrician here, which is a counselor, and I have nine helpers. The team, we have nine women doctor. Two of them are IBCLC also, and we really help the mom and the diet, the mom and the mother, and also with our nurses has already trained how to do with the relactation program, and also induce lactation for adopted baby.
Oh, that's wonderful. It's, you know, it's great that you guys had that sort of support system for the moms. It sounds really wonderful to have, you know, that sort of team where you've got doctors and
Yes, because
nurses and
yeah, yeah. Because here in our country, so many hospitals still give formula and bottle feeding when the baby left the hospital, and so they come to me and to our clinic, and all over Indonesia, from far away from our city, just to attend the relactation program.
interesting. It, you know, that shows just how, you know, important it is to those moms if they're willing to, you know, travel to come and see you and what a blessing for them that they have you as a resource. That's wonderful. So I was wondering if you
Yeah.
could tell us just a little bit about what do you hope delegates who are listening to your presentation are going to take away from the presentation? What do you hope to get across to the delegates?
Yeah, I hope that the delegates will understand that we have to make a big effort, or to fight to help the mother could breastfeed their babies, because breastfeeding will decrease infant mortality rate, especially in our country. Yeah, because
Okay,
if we
wonderful.
don't hospitalize, then the extended family will interfere the mother, and the mother will, yeah, will fail to breastfeed, because they will say, oh, your breast milk is not enough, oh, the baby is still hungry, but it's due to nipple confusion.
Hmm. It's interesting how it doesn't seem to matter where it is in the world, but the moms are hearing that, you know, the breast milk is not enough and you should just give a bottle. And
Yeah, yeah,
unfortunately, that seems to be a
yes,
worldwide thing. So really interesting.
yeah,
Well, I am really
okay,
looking forward to learning more and hearing your presentation. So thank you so much for taking the time to chat with us today.
okay, Fleur, Andrew.
Wonderful. So for our delegates who are listening, you will be able to hear more from Asti about her program for hospitalization for nipple confusion during her live presentation, which will be taking place on Tuesday, April 28th at 1300 UTC. So we look forward to seeing you online then.